Hi, today we'll be talking about how to get pregnant with Clomid. Most doctors have used the word infertility to describe couples who have tried to get pregnant over 1 year and it's not possible despite adequate, unprotected, satisfactory sexual intercourse. Every month, a woman ovulates. The egg travels from the ovaries when released, that is at the time of ovulation. The egg travels from the ovaries when released into the fallopian tube, where it is fertilized by the partner's sperm. And if that happens, pregnancy occurs. Peradventure, pregnancy does not occur, it happens in another month. Some people have infertility because they do not ovulate regularly or at all. A common cause of this is polycystic ovary syndrome, also known as PCOS. In some other cases, the person does ovulate but does not get pregnant. In any of these conditions, it can be managed with hormonal drugs that will help initiate ovulation or enhance ovulation. In other cases, the person does ovulate but finds this difficult or has trouble getting pregnant. In any of these situations, the treatment with hormones can stimulate the body to ovulate, thereby enhancing the chances of being able to conceive. We call this ovulation induction. And so today I'll be discussing ovulation induction with clomiphene, or getting pregnant with clomiphene, Clomid, also known as clomiphene citrate. My name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes I add men's health to it. Follow me on my Facebook page at Talks-with-Dr-Adazion. Subscribe to my YouTube page right now at Dr. Nkiruka Bridget, at Talks-with-Dr-Adazion. I'm also on TikTok and on Instagram with the name Talks-with-Dr-Adazion. If these topics interest you, please watch till the end. Let's go on. Before beginning any infertility treatment, it's important that you and your partner be evaluated and any cause of the infertility found and treatment plan be developed for you both. This may include adequate history taken by a doctor, physical examination, proper investigations, and then treatment. This video does not remove the fact that these drugs must be prescribed by a doctor. Among the investigations that will be done for you and your partner include seminal fluid analysis, where your partner's semen will be checked to be sure that it is complete, it is normal, and that everything about the semen is okay for pregnancy to occur. Then, for you, a blood test can be done. Part of other things that can be done include an ultrasound, radiological investigations. This will help to determine whether you are ovulating. So in any of these investigations done, if it is found out that you are not ovulating, an ovulation induction should be started as soon as possible to give you that chance of getting pregnant. And one of the ways to do that ovulation induction is with the use of clomiphene citrate. Clomid, also known as clomiphene citrate, is a weak estrogen-like hormone that acts on the hypothalamus, the pituitary gland, and the ovaries to increase the release of some certain hormones that are responsible for ovulation. Clomiphene citrate is not the only drug used for ovulation. In other subsequent videos, I am going to discuss another drug known as letrozole. However, in this video, we will be concentrating on clomiphene citrate. Who should be considered for ovulation induction using clomiphene? People who do not ovulate at all or ovulate irregularly due to polycystic ovarian disease, they can be induced with clomiphene citrate. The aim is to induce ovulation and give the person chance of conceiving or getting pregnant. The second group is people who ovulate normally but are finding it difficult to get pregnant. In this group of people, ovulation induction with clomiphene can be tried first, along with intrauterine insemination or any other form of assisted reproductive technology to help them get pregnant. How will you take the medication? Before starting medication, that is clomiphene, or any other medication for induction of ovulation. If you have polycystic ovarian syndrome, also known as PCOS, and you are overweight or obese, you may have to lose weight, at least 5 to 10% of your body weight. When you lose up to 5 to 10% of your body weight, your ovulation may return sporadically and your menses will become regular even without medications. There are ways to help you lose weight that will be discussed in another video. Now, the drug clomiphene citrate has different dosing depending on where you are in your menstrual cycle or in your menstrual flow at that time. If the first day of your menses is the first day that your menses starts, we'll count it as the first day, then you count subsequently. Clomiphene citrate is usually started on the second day, third day, fourth day, or fifth day. If you are going to start taking it, you start either on the second day, third day, fourth day, or the fifth day. However, you are going to take it for 5 consecutive days and you stop. Ovulation is expected to occur between the 14th day and 19th day of your cycle. If you have never menstruated, or you're having problem with your menses, or you're finding your menses have started and stopped, or you're finding it difficult to menstruate, your doctor will give you another drug known as progesterone. And when the progesterone will help you to start bleeding. We call it an artificial menses, and you start the clomiphene as already discussed on the second day, third day, fourth day, and fifth day, and you stop. The dosing is increased gradually if the person does not ovulate with the lowest dose. The lowest is actually 50 milligram, can increase to 100 milligram, can increase to 150 milligram. So it is increased in a sequential dosing. If you have taken clomiphene for 3 to 6 cycles and ovulation has not occurred, you are advised to stop. Your doctor can change to another form of ovulation induction or may advise you for another form of getting pregnant, which include assisted reproductive technology. If you use clomiphene citrate or Clomid for ovulation induction trying to get pregnant, when you stop taking the medication, we advise you get at-home pregnancy kit, or you use follicular tracking to make sure that you ovulate. And we encourage you start having sex every other day, at least from the 5th day after stopping the drug. That is 5 days from the time you stopped the drug until when you ovulate or when you are about to see your menses again. We hope that frequent intercourse with ovulation induction improves the chances of getting pregnant for that cycle. So you don't take clomiphene citrate and stop planning to get or reduce your coitus or coital frequency. If you really want to get pregnant with clomiphene, we encourage you to use at-home ovulation kits to know when you are ovulating, or use follicular tracking with ultrasound to know that you actually ovulate. The other ways to improve your chances of getting pregnant with Clomid include, if you are already on clomiphene citrate induction ovulation induction rather, you should have lifestyle modification. If you are obese, please try as much as possible to lose weight. It will help you so much to get pregnant. If you are on alcohols, please reduce your alcohol intake drastically. Stop smoking, reduce your caffeine intake. Then, if you are overweight, please, nutritionally you can modify your diet. If you are underweight, because another cause of anovulation is severe underweight. So if you are underweight, you have to improve your nutrition so that your weight can be optimal for ovulation and fertilization to occur. If you have tried clomiphene citrate and you do not ovulate, other forms can be used to help you. Other drugs, which are mentioned in other videos, can be used to make you ovulate, which include letrozole, gonadotrophin releasing hormones, gonadotrophins. Clomiphene citrate, as good as it sounds, is not without side effects. Some of the side effects, though not limited to this, include hot flushes, breast tenderness, headaches, mood changes, visual disturbances that will occur in form of blurring of visions or even double visions, nausea and vomiting, bloating. You notice that if you are taking it, some of them will say they feel bloated. So those are side effects of Clomid. Now, there are other side effects which may be good to some and may not be good to some, which include multiple pregnancy. It's been noted that people on clomiphene ovulation induction actually have about 3 to 8% increase in multiple gestation, especially twins, not really higher order pregnancies. Then other things include cervical changes. During ovulation, the cervical stage is usually thin and stretchy. With clomiphene, it changes to thick cervical mucus and may impair sperm penetration into the cervix. So these are the side effects of clomiphene when taken. If taken for a long time, there is a lower risk of ovarian cancer associated with clomiphene. So if you're taking clomiphene for ovulation induction, make sure it is prescribed by a doctor, followed up so that you don't miss when you ovulate, and the side effects adequately reported to your doctor. I wish you the best of luck. In the next video, we'll be talking about other drugs like human chorionic gonadotrophin, letrozole for ovulation induction, and other forms of getting pregnant with assisted reproductive technology. Thank you for watching to this point. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. Subscribe to my YouTube page, drop your questions in the comment section, and I will answer them. I have other videos that are coming up. Please make sure you stay tuned. Share this video too. Thank you for watching. See you next time.